Today we talk about what to expect at your semen analysis appointment, the cup, the clock, the awkwardness, and why this test matters more than most people realize.
I'm Dr. Mark Amols, and this is Taco Bout Fertility Tuesday.
Back in 2019, I did an episode on endometrial polyps and the semen analysis. And that episode was really just talking about the results of the semen analysis. But I never really talked about the appointment and the awkwardness of it. And so today, we're going to talk about one of the simplest but most awkward fertility tests, the semen analysis. And yes, we're going to talk about the cup. When couples start fertility testing, most of the attention goes to the female partner. Blood work, ultrasound, tubes, uterus, ovulation, egg count, and hormones. And then when it comes to the male partner, we say, well, here's the cup. But that cup gives us a lot of important information. A semen analysis can help us decide whether timed intercourse makes sense or whether an IUI is reasonable, whether IVF is needed or ICSI may be needed, and whether a reproductive urologist should maybe get involved. So in this episode, it's not a deep dive into every number on the report, but it's more practical. It's about what happens at the appointment. How do you prepare for the appointment? Can you collect at home? What if you missed the cup? And what if the results are abnormal? So let's make this a little bit less awkward by actually talking about it. As I just mentioned, a semen analysis is one of the easiest ways to get important fertility information. It's a non-invasive, relatively quick, often less expensive test compared to other fertility tests. And male factor infertility is very common. Fertility is not just an egg issue, or a uterus issue, or a tube issue. Basically, it's not just a female problem. And the thing is, if the sperm count is low, or motility is poor, or there is no sperm in the sample, then that completely changes the plan. So skipping a semen analysis is like trying to solve a mystery while ignoring one of the main suspects. And importantly, this test is not a masculinity test. It is not a manhood report card. It's just data. And that data helps us make better decisions. Now the question is, you're going to go do this test. How do you prepare for it? Well, most clinics will ask you for a few days of abstinence before the test. Usually this is around 2 to 5 days, but obviously follow your clinic's instructions that they give you. Now, too short of a window and the counts may be a little bit low and the volume may be low. Too long of a window and that can affect the motility of the sperm. The longer the sperm is sitting there, the more free radicals and heat can affect it and can affect the quality of the sperm, which can make the analysis look poor. So the goal is not as long as possible, the goal is the right timing. As a guy, we all know the longer you wait, the more sperm you make, and that makes us feel a little bit better. But in this situation, don't worry about how much volume you ejaculate. What we care more about is the quality of the specimen. It's also important to let your doctor know if you recently had a fever or if you use hot tubs or saunas or even started new medications such as testosterone or anabolic steroids, marijuana or other supplements because those could affect the semen analysis. And testosterone deserves a special warning. Many people think testosterone would improve fertility. I mean, it makes sense. Your testosterone is what makes you a man. But it actually does the opposite. Testosterone can shut sperm down to zero. So if you're taking it, your doctor needs to know. So let's talk about the appointment. Usually you check in, you confirm your identity, and you get a sterile cup, and usually some instructions with it. They usually will bring you to a private room where you will then collect the sample, usually by masturbation. And yes, it can feel awkward. I know, I've done it myself. If you go too fast, then you're thinking, oh great, they think I just can't last that long. And if you go too long, you think, oh man, now they think I'm enjoying this too much. So there's no perfect time, but it's very awkward. And then there's the cup. That cup looks small, and then you give your sample in it, and oh my goodness, you start to feel like you didn't even ejaculate anything. And that's normal. And that's because the amount of ejaculate is usually only around 2 to 5 milliliters. that will barely even get the bottom of the cup covered. So don't worry when you notice that. Don't freak out. And here's another thing. The staff, they're not going to be shocked. This is a routine for the clinic. They're not gossiping in the background. This is just another day for them. For you, this is not normal. Maybe you don't masturbate that often, but even if you do, you normally don't do it in a public facility. That's why it's important to make sure you get a good collection and get to the lab quickly. You shouldn't use lubricants, but if you need one, make sure you speak to the lab because you need to use a sperm-safe lubricant. Now, for people who have religious reasons why they cannot masturbate, there is condoms that you can use. They're specially made that can be done to collect the sample, but do not use a regular condom. And most important, even if they say you can do this from home and bring it in, do not collect in some random container and then bring it over. The containers they use are specially tested to make sure they don't hurt the sperm. So make sure you use the sterile cup. Now, I just mentioned a second ago, what if you can't collect in the office? Well, this actually happens more often than you think. And honestly, a lot of clinics are now starting to offer at-home collection, not just from the clinic, but also there are now companies, third-party companies, where you can collect from home and then it can be sent out to these labs. And there's many reasons why you cannot collect in office. One can be nerves. Sometimes it's just the setting. And again, as I mentioned, religious, cultural, even medical reasons that make it difficult. If this happens, tell the clinic. As awkward as it may feel that you can't give the sample, they're used to this. So don't be embarrassed. Don't panic. Just step out and say, I can't do this today. I'm going to need to find a different way or at home. And if you already know you're probably going to have a hard time collecting at the office, let them know ahead of time so you can make a plan. Even myself have ran into that problem. When I was going through IVF with my wife and we were in the clinic in Scottsdale, I was seeing patients that day. And when I was trying to give the sample, certain patients showed up and my staff started knocking on the door to let me know they were there. Now, I appreciate there are professionals out there who can do certain things with people watching at them or with sounds being around them. But for me, someone knocking on the door every few minutes telling me there's a patient waiting for me was not the setting I was looking for. Luckily, we have frozen sperm that I collected from home in the past, and we use that, and that's how I have my sons. Now, when we're talking about at-home collection, it's going to matter which type you're using. If you're using the clinic's collection kits and then bringing it to clinic, timing matters. Usually within the next 30 to 45 minutes after giving the sample, you need to get to the lab. And that's because the temperature is going to affect the motility. Now, you would think, oh, I should probably put this in something cold. No, not at all. You want it to be close to your body to keep warm. Do not put it on ice. Do not put it in a refrigerator. And also, don't leave it in the hot car, especially in Arizona. Now, when you give that sample to the lab, they're going to know the collection time, and they're going to know if there were any issues collecting the sample. The reason the time matters is because motility changes over time. That's the clock part. The cup matters, the clock matters. Then we get to the count. Now, one of the most difficult things when giving this sample is that when you have an erection, it is very difficult to aim for a cup because your penis doesn't bend down, or at least shouldn't, and the cup can't be turned sideways or things will come out. In addition, they also want you to not touch the cup, which also makes it a little bit more difficult, since most of us men have never tried calculating the trajectory of our ejaculate through a small hole. And so sometimes you are going to miss the cup. And you're not going to miss all of it. You might miss a portion of it, but it's important to tell the lab. Seriously, do not hide this. It's very important. And what portion of your ejaculate misses the cup is also very important. The first part of the ejaculate often has the highest concentration of sperm. If that part misses the cup, the results will look much worse than if it was the very end portion. So, if some miss the cup, say something. The cup had one job, and sometimes the cup loses. It happens, but it's important for the lab to know. As crazy as this sounds, I've actually had people miss the cup and then pick up the sperm off the ground and then put it back into the cup. And surprisingly, this even happened for an IUI. If this happens, do not pick it up, let them know, and you can just schedule the semen analysis for another day. Now, as I've mentioned, I don't want to go into the deep interpretation today. We can send that for another podcast episode, or you can listen to the old one back in 2019. But the lab usually looks at a few things. One is the volume, which is how much fluid is there. Next is the concentration, which is how much sperm is present divided by the volume. Motility is looking at how many are alive or dead. A lot of people think it's how many are moving, but it's not. That's progressive sperm, like forward progression. And then morphology, which is how the sperm are shaped. And we do look at a couple other things, such as the pH of it, as well as we look for any type of particulate that might be in the sperm. When it comes to like the main number that we use for determining fertility treatment, it's usually the total motile sperm count. That's where you take the volume, multiply it by the concentration, multiply by the motility, and you get the total amount of moving sperm. What the semen analysis is not asking is it's not just saying, is sperm there? It's asking, well, how many sperm are there? And if they're moving, are they moving in a straight line or just in a circle? Do they look normal? And is there anything unusual about the sample? And could it be used for fertility treatments? So you do your semen analysis, you get the results, and what if they're abnormal? Well, first, don't panic. One abnormal semen analysis does not automatically mean infertility. Sperm results can vary even between analyses. Sometimes a fever, illness, heat exposure, as we talked about testosterone, certain medications, alcohol, even collection problems can affect the results. And sperm production takes about 2 to 3 months, so something that happened weeks ago can show up in the sample today. That's why we often repeat a semen analysis test if it's abnormal. One bad semen analysis does not mean the game is over. It may just mean we need another sample, or maybe we need to find out more about your history because there's something further there that we didn't realize, such as you having COVID 3 months ago. Now, sometimes you do need to make changes, such as repeating the test, doing hormone testing, changing our lifestyle, sometimes seeing a reproductive urologist. And even if you don't do those things, there are treatments that can be done for different counts. And doing those other things might help you move between things like IUI or IVF, or potentially even timed intercourse. The point is, abnormal does not mean hopeless. It just means we need to come up with a plan. I've had patients come in and give a semen analysis, and there'll be only a few million. And then they come back and do another one, and there's like 80 million. And then later, the patient will tell me, oh, well, yeah, we only had less than a day of abstinence. Again, this is why this information is so important, because it helps give the context of the results. Let's talk about a few myths. Myth number 1. I already have kids, so my sperm must be fine. No, not true. It just means you must have sperm at some point in your life. But sperm changes, especially as men get older. Myth number 2. If the semen analysis is abnormal, IVF is the only option. Not necessarily. It depends on how abnormal it is and what else is going on. Many men can end up doing artificial inseminations, also called IUI, when the sperm count is low but not super low. Myth number 3. Testosterone helps fertility. Absolutely false. Testosterone actually suppresses sperm production, and for many men, they're not getting pregnant in a relationship because they're on testosterone. When I've taken care of weightlifters, they'll actually come off of the testosterone just to get pregnant and then get back on it later. Myth number 4. Morphology is everything. It is absolutely not. Morphology matters, but count, motility, total mole count, that matters more. Yes, it sounds scary when you're told that very few of your sperm are normal looking. But guess what? Most of the sperm is abnormal looking. As I always joke around and say, the reason men make millions and millions of sperm is because they do it so bad, it takes that many to get one good one to the egg. Myth number 5. The sample has to be perfect. No, it doesn't. Matter of fact, it just needs to be collected correctly. Yes, things are going to happen. You might miss the cup. Maybe you didn't wait as long as you're supposed to. But the goal is accuracy. So as long as you let the team know these things happen, they can then look at the sample in that context and make sure everything is okay. Now let's be honest. Compared to what women have to go through, men do not have to go through much. But let's also be honest, it is extremely awkward. Yes, masturbation is a common thing. What is not common is that you go into a room and everyone in the building knows what you're doing. That is what makes it very awkward. Then there is that part where men feel it represents their manhood. Low sperm count can make a guy feel like he's not manly enough. Taking too long and now people think, does he have a problem? Can he not get it up? And unfortunately for men, when it comes to our penis, we think of it as the main part of our manhood. So yes, from an outsider, it seems quite strange why it's such a hard test and why men don't want to do it. But from the guy's view, it's extremely awkward. And it potentially could show that you have a low sperm count, which you may believe is part of your masculinity, and then you can feel demasculated. So remember, if you're a guy listening to this, it's not a masculinity test. And yes, it is awkward. But the good news is, it's just data. And in fertility, good data helps us make better decisions. So yes, the cup is awkward. And yes, everyone knows what you're doing. But the good news is, this is what they do every day. So it doesn't bug them. Unfortunately, fertility is complicated and involves sensitive things. If you're the female partner listening to this, keep in mind, yes, it might be something they do all the time, but they don't do it in public. And they don't usually have a bunch of people thinking they're doing it in public. And although it's one of the simplest tests and the least invasive test, for him, it is difficult and it is extremely awkward. So let him know how appreciative you feel for him doing that and being in an awkward situation. Then later in the cycle, you can make him feel guilty for all the stuff you had to do. Because in reality, you do a lot compared to us men who have to overcome our fear and the awkwardness. Hopefully you found this episode helpful. Maybe you know someone who's going through fertility or a guy who's not wanting to really do a semen analysis. Maybe even your partner doesn't want to do it. Tell them about this episode. Maybe it might help them feel a little more comfortable when they go into that room. If you like this podcast, please tell your friends about it. Give us a 5-star review on your favorite medium, but most of all, keep coming back. I look forward to talking again next week on Taco Bout Fertility Tuesday.